Have you ever felt the sting of a medical bill and wondered why your life savings are being drained for basic health care? Malaysia stands at a critical juncture where the absence of a national health insurance scheme could be the very gap that plunges countless Malaysians into financial turmoil. Imagine a country where healthcare isn't a privilege but a fundamental right. The question isn't if we can afford a national health insurance scheme, but rather if we can afford to live without one. At present, Malaysia's healthcare system hangs in a delicate balance. Government hospitals offer basic care, but with the rising costs and limited resources, the quality and efficiency of these services are dwindling. Long queues, overworked staff, and resource shortages are now the norm. Meanwhile, private healthcare shines brightly, but remains an elusive dream for the average Joe. As costs soar into the stratosphere, this chasm between public and private healthcare is widening, leaving the common man grappling with fear and uncertainty in times of illness. The implementation of a national health insurance scheme could be the bridge over these troubled waters. Such a scheme would pool resources and risks, ensuring that everyone, regardless of their socio-economic status, can access quality health care. Look at countries like the UK with their NHS or Canada. Their citizens rest easy knowing that their nations have got their backs during medical crises. By spreading the costs across the entire population, it becomes possible to offer care that doesn't discriminate between the wealthy and the poor. However, transitioning to a national health insurance scheme isn't without its challenges. Funding this behemoth is the #1 hurdle. It may require higher taxes or reallocating current expenditures, but consider the long-term benefits. A healthier workforce means a more productive nation. Countries with comprehensive health insurance often experience lower rates of absenteeism and higher productivity. Prevention and early intervention can drastically cut down long-term healthcare costs, balancing out the initial investments. The political landscape is another maze to navigate, with various stakeholders, including private insurers and healthcare providers, having vested interests. Consensus will be hard-won, yet it is a struggle worth undertaking. When we talk about progress, it's not merely economic growth, but social justice and equity. If we aspire to be a developed nation, ensuring that every Malaysian has access to quality healthcare must be a priority. In the end, it's about choosing the type of society we want to live in. We can continue to ignore the divide, hoping it won't get worse, or we can take brave, decisive steps towards securing a healthier future for all Malaysians. Let's put aside our differences and work collectively for a sea change that will be remembered as a milestone in Malaysian history. So is a national health insurance scheme too much to ask for? Absolutely not. It's the very least we deserve.